are you today, sir?
Good, how are you?
Doing very well. You tried magnetic therapy?
No, I haven't, but I was looking at your signs here. It says it's supposed to help with sleep and stress, and I've had carpal tunnel syndrome, occasionally. They're working on the computer and whatnot.
Okay.
So does that cure that or help with that?
Well, magnetic therapy is not going to cure anything.
Oh, really?
And the best way to explain how magnetic therapy works is that I have carpal tunnel myself, and I wear this bracelet. So as my fingers are feeling pain, of course it's going to send a message to my brain.
Right.
So as that message starts coming out, and it passes underneath the magnet, if the magnet is strong enough to penetrate through the whole skin, what happens is that message on this side of the magnet is all scrambled up. So when it reaches my brain, it's like, well, it sounds like he's in pain, but the brain just doesn't really know. That's why I'll go from a 10 to a 3 or 4. I can live with a 3 or 4, but I can't live with a 10. And honestly, in 8 years, I have never seen anybody come back and say they were 100% without pain. But a lot of people say they can live with the 3 or 4, not the 10. So magnetic therapy does not cure anything. Now, British Journal of Medicine says 12 weeks of wearing a magnetic, 12 weeks, at the end of 12 weeks, wherever you're at, from that point forward is what you're going to maintain. So let's say if you start today and you're at a 10, and in 12 weeks you're at, say, a 4. From that point on, you're going to maintain it wearing your lariat or your magnetic from that point forward.
Okay.
That's why our warranty is that in 12 weeks, when you get to that point, you say, hey Clay, it ain't worth it. Then we'll refund 100% of your money. You may be 1 in 200 that it doesn't work for, but in 8 years we average about 1 in 200. Wow. It just doesn't work for, but it doesn't cure anything.
That's a good deal.
And that's really how it affects.
Now, you said something about the strength of the magnet and its effectiveness on the pain. You have different strengths. How would I know what strength that I should buy to start with?
Okay. Again, the strength of the magnet is very important. As you see here on this diagram, about 3,000, 5,000, 7,500. It requires you to be able to penetrate. So, this is similar to what we have as cosmetic. This is magnetic jewelry. That magnet there is 250 Gauss.
And the Gauss is the strength of the magnet.
The strength of the magnet. That's 250 compared to this one at 10,000. 250 to 10,000. Now, magnets will not harm you. There's no research that wearing a magnet is going to cause you any pain, unless you have a pacemaker or insulin pump. You don't have any of those.
No.
Okay. Then, what we suggest is a 10,000 lariat.
Mm-hmm.
It's all magnet, as you can see. It can be used as a necklace. I use mine around my neck, and I let it lay down my spine. That influences the whole body.
Really?
So, the strength.
It's good for back pain and
back pain, lower back pain, hip pain. Because all your muscles, remember what I said, as far as it scrambles the system, the message. Laying on my spine, everything that is coming up has got to run through that back. That's why. Now, be strong enough in the magnet, you've got to penetrate that deep. That's where we say a 10,000 Gauss. Now we have it in 5,000 Gauss, 7,500 Gauss, or 10,000.
And the lower ratings are less expensive?
Less expensive, but when you look at the value of money, you're wanting to say a 10,000 because it's going to help you with the neck, around your arm, around your feet at night for sleep.
It's pretty versatile, isn't it?
It is.
So if I wanted to start with something less expensive and it didn't work, what then would I do?
We have a 7,500 like this. And what we say is that try it for 2 weeks. If you're not feeling any benefits within 2 weeks, come back, we'll let you upgrade to a 10,000.
Oh, really?
Pay the difference. The 7,500 is $29. This is $39.
Oh, wow.
But you're talking about 10,000 Gauss, and not only your pain, wrap it around your ankle at night for better sleep.
I think I'd be interested in that. Trying that and seeing if it worked.
And our warranty is written, so we'll give you a written warranty on that.
Great.
Would you like to wear it now?
Yes, I would.
There you go.
Thank you very much.
You're welcome.
And that's about it.
Yeah, that's simple.